Morning everyone, Dr. Eric, the fitness physician, where I help everyone, especially those who are over age 40, optimize their health, hormones, and metabolism so they can live a life full of strength, energy, and vitality. I'm doing telehealth all across the country. I'm going to launch my weight loss program at primaxweightloss.com. And of course, I'm doing telehealth for hormone optimization, anti-aging, muscle medicine, hormone therapy, hormonal fitness, and much more. So many things. So biggest things are weight loss and hormone optimization. And again, we're getting ready for spring and summer, so we want everybody to feel good, look good, feel their best, so they can live to give, right, and give back to help others around them feel better. That's my message. That's my mantra. I want everybody to feel good and feel good about themselves, so they can give back to other people, feeling your best, looking in the mirror, feeling confident that you can attack the world, attack the day, and be the father, the wife, the husband, the businessman, the spouse, whatever you need to be, whatever role you play, to be the best that you can be and feel good, look, and feel confident in yourself, knowing that you can do it. That's my goal and my vision for you. So a little bit of a longer intro today, but I get excited about this stuff, and I've been doing a little series on PCOS. I have a lot of women that I talk to and help with PCOS. It's a very common endocrinopathy. So if you missed the first couple of videos, go back and watch those. Those are important. So today we're going to kind of wind things down. I got a few more coming up in the near future, but today we're going to go down a little bit on some of the hormonal side, what we're doing about it. I talked a little bit about aldosterone, how it can increase LH, luteinizing hormone, and inflammation. This is one that's often forgotten about, that aldosterone has a big effect in PCOS. So it's about the insulin and aldosterone, and both these can cause inflammation and sensitivity of end organs, meaning the skin and the hair, and lead to the problems. Again, it's not just about the elevated testosterone, which a lot of women have, some women don't, but it's more about the effects, right? The effects on the skin, on the hair, on the fat tissue. So this is why spironolactone is so important, because it reduces this inflammatory process, and it can help, especially most people think of it being used for the skin when women have acne or excessive hair growth, or what we call hirsutism. And yes, it is definitely used for that, especially in younger women. Can definitely block this effect. This is why a lot of women, and also even though sometimes it's an endocrinopathy and people think it's a testosterone, some women still need testosterone, but what you do, you have to block this excessive effect on the skin, the hair, with spironolactone. Because if you just give them testosterone, they're going to have more acne, more hirsutism, which of course you don't want. But this can block this, and therefore they can get the best of both worlds. But it's very tricky. You have to balance these out, but it can be done. I've done this many times. More importantly is that effect on inflammation, because if this inflammation can affect the kidneys and cause high blood pressure and many other, of course, processes in the body, which we don't want. So, and this is even more important for women as they get over 40 and 50, because a lot of women think they can outgrow the PCOS. They don't. This becomes more important, because then, of course, we have to worry about decades of inflammation, and of course that's when we start getting at high risk of cardiovascular disease, hypertension, and all those other things. And if this is uncontrolled, this can make it even worse. So it's even more important for older women to use spironolactone. Metformin has been used forever for many things. It can lower insulin, reduce insulin resistance. It can reduce that LH and testosterone all by itself. It increases SHBG, sex hormone binding globulin, and it improves ovulation and fertility tremendously. By increasing SHBG, it's going to drop the end effect of the testosterone, right? It's going to drop your free testosterone because it's binding it up. And again, a lot of these women, they have too much, testosterone. As I mentioned, it's not always a problem. If you're younger, you're still going to have an effect. But again, you want to reduce the effects on the skin and the hair, and metformin can do this, as can spironolactone. And yes, it can cause some weight loss, modest, but not always in all women. Some women it helps quite a bit, some not. But more importantly, what it does is improves the metabolic effects, the health effects, by reducing insulin resistance and increasing SHBG, which has metabolic effects as well. And a lot of women use this, again, because it helps with fertility and ovulation. A lot of women, if you just give them progesterone, metformin, they can get pregnant finally, even though, and this is a big deal, right? Because a lot of women are not being able to get pregnant because their fertility is adversely affected. So this is huge. So metformin is very, very important. It's all been considered the drug of choice for decades. Obviously, there are some things we can do now that can help with other things even better, but this is still a staple. The other one is progesterone. Again, massively important. This is often forgotten about. Young women often get put on birth control pills, which can be helpful, but you're just knocking all your hormones out, and then they can have some adverse symptomatology because they're blocking everything too much. So oftentimes, just give progesterone. It's simple, it's bioidentical, just like your own progesterone has a lot of health effects. Again, this, as I talked about in the first video, is because of unbalanced estrogen with not enough progesterone for years and years. This can lead to higher risk of breast cancer and uterine cancer, and of course adverse effects on the skin and the hair, as I've talked about. So we need to balance this out. So progesterone can help this. And again, with the metformin, it can massively improve fertility and help these women get pregnant. Another one is thyroid, massively important for metabolism, and a lot of women just don't have enough effects on the cells of the thyroid. And this is why a lot of them have problems with sluggish metabolism, weight gain, and so much more. And again, thyroid, of course, helps improve insulin resistance, lowers risk of cardiovascular disease, and much, much more. And more important, with women with PCOS often have a decreased conversion of T4 to T3. This is often forgotten about. So some women just need thyroid hormone. So it's going to help with all these things. And again, it's all related to insulin resistance, inflammation, and much, much more, which leads to the risk of cancer, cardiovascular disease. This is what we want to prevent. So we want our patient to look and feel good, but we want to make them healthy, live longer by preventing these diseases, and this is what can be done. In the future, I'll talk about some other videos. Of course, we use a lot of other things too, like GLP-1 agonists, right? Semaglutide, liraglutide, etc. These can be massively helpful for women with PCOS, especially with weight loss. If they're not getting effects with this, we can add on the GLP-1 inhibitors. These have been very, very successful with me. And again, if you have to play with all these together, it's like a symphony. It's very tricky. There's no one-stop shop. There's no cookie-cutter approach. You have to individualize this to each woman. This is where it becomes very important. This is the art of medicine, and this comes with experience and medical training. Please don't go to a quick stop shop to get your semaglutide in 5 minutes, which a lot of people are doing, and they're having bad outcomes. I've seen it. So and there's some other treatment options as well, of course, for weight loss, which I'll talk about in the future, but these are the big cornerstone ones for health, for optimizing your health and hormones, and getting healthy and living longer, stronger, better, improving your fertility, improving your skin, reducing your risk of disease, and much, much more. So anyway, like this post, tag it, share it, comment below what you liked about it, what you want to hear more of, and I'll gladly respond. So please type in PCOS if you want to hear more videos about PCOS, or if there's anything else you want to hear about, please let me know. Remember, knowing telehealth all across the country, dreric.primex.com and primexweightloss.com. Everyone live to give, do something nice for someone today, pass it forward, and have an awesome day. We'll see you next time. Bye.